Hi, this is Scott. We're going to cover the Incident Command System ICS refresher and Incident Action Plan and IAP and review. It's been a long time since we've done any type of review of Incident Command, even though we've been experiencing it firsthand the last few years during the COVID-19 response. Using the fundamentals of the ICS model and modifying the health department needs helped us make the COVID-19 response more organized and effective. This is meant to be a quick review of the ICS basics. The following are the basic principles of ICS. These principles are not set in stone, but are meant to be flexible enough to meet any type of response needs. We use ICS to fit our needs, whatever that may be. Basic principles of ICS is it's widely applicable, so it can be used for any type of incident. It's scalable, means it can be for a very small incident or a very large incident. It's manageable, which means it incorporates manageable objectives that can be completed. Some basics for organizing staff are needed to be followed in order for ICS to function. Response efforts need to come through the incident commander to ensure we are working toward the objectives. Each person has one person to report to when assisting in the response. Information can be shared with anyone, and the span of control should be limited if possible, so not too many individuals are managed by any single individual. The incident command team consists of incident commander and 4 principal groups for the response. The incident commander would normally be the health commissioner, but this is not 100% hard rule. Another person, though unlikely, might be the incident commander. For example, if the health commissioner was on vacation and an incident occurred, a backup may be required to fill the incident command position. The incident commander sets the objectives and has the overall authority and responsibility for the incident. Command staff. These are the typical command staff depending on the level of response needed. Command staff may need to be appointed depending on the complexity of the incident. They may include a public information officer, safety person, liaison, and subject matter experts. The Health Department Emergency Response Plan gives guidance in a table on deciding on a level of response from level 1 being normal operations to level 4 needing the most involved response. Suggested staffing is also addressed in each of these response levels. Command staff reports directly to the incident commander in addition. Command staff personnel. The health department has a PIO and a backup PIO. Depending on the response, an assigned safety person may be required. A liaison person may be needed if numerous support agencies are involved. Subject matter experts assigned will be determined by the incident commander and their needs. The general staff consists of 4 areas and are responsible for their areas. The 4 areas are operations, logistics, planning, finance, and administration functions. They're expanded as needed during the incident. These 4 management functions are the general staff and are also report directly to the incident commander. Operations is the first section. Normally, the Community Health Services Division of the Health Department leads the operations of a response. During the COVID-19 response, they manage the vaccinating of the community at all of our vaccine clinics. This included the Fulton County Fairgrounds, where 409 people were vaccinated a day, to the Health Department, where up to 180 people were vaccinated daily. This group is led by the Operations Section Chief. Logistics is the next section. Normally, the Environmental Health Division leads this effort. During the COVID-19 response, they made sure that mass clinics were set up and had the necessary resources to operate the clinics and work to manage and distribute PPE to our healthcare and other partners, and requested resources as needed through the Fulton County EMA. Finance and administration is the next group in section. Finance ensures we track expenses, manage government funding for the response, and make sure everyone gets paid. A tough undertaking during COVID-19 response, especially with all the additional grant monies that we had. Planning is the next section. The planning section tries to anticipate and speculate on what may be needed and what might happen. They also develop an incident action plan from input from the incident action plan meetings and incident command, which identifies objectives for the next operational period. The incident action plan. An IAP was routinely updated from March 13, 2020, when the Health Department, DOC, and Emergency Response Plan were activated, until April 19, 2022, when the DOC and ERP were deactivated for the COVID-19 response. A total of 104 incident action plans were generated during the COVID-19 response. The incident action plan consists of specific goals or objectives that are required to be done in a time frame, and identify the parties that will accomplish these objectives. The planner updates the objectives in the IP based on objectives meeting input and forwards to the incident commander so they can approve, and then it can be disseminated to the health department staff and other partners in the community. It's constantly evaluated with changing conditions and it's constantly changing. The incident action plan, basic components: incident situation summary, incident organizational chart, a health and safety information section, and of course the incident objectives, which are the heart of the incident action plan. The IP should be written, one, for the actual response and also for good documentation for future incidents. First part of the incident action plan has the name, operational period, date, and a situational summary. This one was from the 97th operational period in December of 2021. We were just using for an example. Also, we have an organizational chart in our incident action plan. This identifies the key positions for the response and it gives them the responsibility of each of the sections and each of the command and general staff. We have a health and safety information section. The whole purpose of this is to identify any safety hazards or anything that we need to do to protect our responders regarding, and it could involve personal protective equipment or any other actions that may be taken. Finally, the incident objectives, as we stated, they are supposed to be well written so they can be completed. They need to be assigned to somebody and have a definite date or time. You'll notice in this one it has ongoing. We did use ongoing a lot during the COVID-19 because we had objectives that we did from week to week throughout the response. And at one time we had up to 20 objectives on our incident action plan. The incident action plan has an approval page. This approval page is for the incident commander to sign and approve so it can be disseminated to staff and partners. In addition, I do want to mention that we have an AAR improvement plan that was completed for our response from March 2020 to March of 2022. I have a hard copy at my desk for anyone that might want to take a look at it. And feel free to come and get it and read it. That concludes our ICS training for the year. If you have any questions, please give Scott Straw a call, emergency response coordinator. Have a good day. Bye.